The best of Money Matters. The Big Story.
Welcome to The Big Story. I'm Hongbin, Jeong. Now, a $52,188 monthly rental bid for a general practitioner clinic in a Tampines HDB estate has recently caught the attention of the public eye. Even Health Minister Jeong took to social media to express his dismay by this news. In a Facebook post, Mr. Jeong reassured Singaporeans that bids for future HDB GP clinics will be assessed using a model that focuses less on price and more on quality of care. So what would that model look like, and what kind of impact will we see on current bidding prices and property prices then? Well, joining us today to share more is Edward T., who's Associate Professor of Law and Urban Fellow at the Singapore Management University and consultant at WongPartnership. Hi, Professor. Welcome to the show.
Hi, good evening. Happy to be here.
Thank you so much for joining me, Professor. This $52,188 monthly rental bid for a GP clinic, is that something that's been heard of? How common is it for commercial rental bids in HDB estates to reach levels as high as, $93 per square foot?
Yeah, so the number is definitely very high, and I would say it's probably going to be seen as an outlier when we look at the trends going forward. At the end of the day, it was a bid made by a market participant who wanted to bid this number, and under the rules of the game which were set, he had won the bid. I do think it's a bit of an outlier because, generally when we're looking at property valuation, we think of yields, and if the HDB shop unit is going to yield anywhere between 6 to 8%, then we are assuming that the valuation of the unit is somewhere between $8 to $10 million because it's more than $600,000 a year. I'm not quite sure. I don't think the shop is going to be worth that much. So it could be that we've come across somebody who was a bit too over-enthusiastic in making the bid.
Mm-hmm. Well, given that the average tendered rent for similar size clinics in 2024 was around $9,800, why was Tampines Clinic's rental bid more than 5 times higher?
Yeah. So I think that there are two things to think about here. One of them, as I said, it's really how enthusiastic the bidder was, how badly they wanted to win the bid. And really, if somebody wants to bid a very, very high number, which goes beyond market norms, which goes beyond what the market actually values it at, you can't stop this person, right? They didn't do anything wrong. At the same time, I think there were reports suggesting that this individual, he saw the attributes of the unit, the high traffic flow, human traffic flow in the area, good location, near amenities, etc., etc. So those are the factors which he probably took into account at coming at this very high number. But as I said, going forward, it might well be a statistical outlier.
All right. Well, do you think the current open tender system for leasing HDB commercial units is suitable for essential services like GP clinics?
Yeah, so again, this is not an easy question to answer because obviously the fear is that if the rental prices are too high, then it will cause the cost of medical care to rise. But at the same time, this amount of money, the rental that is being paid, is going to the public coffers, which the government will then redistribute, will spend on the country as a whole. So it's a tension. Obviously we are not going to say it's going to be $1 a month. And I think there's consensus that $50,000 a month is excessive. Exactly where we draw the line is difficult because the money is still going to the public coffers. So it's a tension, and I think that's why the government is exploring some means to adjust and influence these bids going forward.
So you're saying higher rents could translate to higher healthcare costs. I mean, what kind of implications could this have for patients?
Yeah. So I took a look at what this particular bidder is saying, right? And he's saying that he's not going to increase prices. So he's clearly, his business model is clearly banking on volume. So if I can't charge $100 a patient, I'm going to charge $10 a patient or $30 a patient, then I need to get more patients. I need to get more volume because my overheads are higher. Singapore is not a huge country. If this particular clinic is charging more money, obviously patients within reason can move to another clinic because we are talking about a single clinic here. So it's not a systematic issue because it's a single clinic, which may well be an outlier. Obviously, the health minister is concerned because his concern is that healthcare prices will tend to rise because this number has to be paid by somebody. And hopefully, if the business model works, then it's going to be through volume. which does not necessarily result in the price per patient increasing.
Right.
And obviously, we don't know whether this particular clinic will be profitable. Right? The bidder himself thinks that he would take up to 2 years to break even, for instance.
Well, as you mentioned, the co-owner of iHealth Medical Holdings has told the Straits Times that his bid was justified because of the attractive attributes of the area. But if a GP group like iHealth believes it can sustainably operate at a high rent site, should the government interfere with that commercial decision?
Yeah. So, you see, it's an interesting question because the government interferes. It's basically saying we will collect less money because it's a HDB shop house, and we have decided to take less money for the public coffers, which is eventually for the public. So it's a narrow base in healthcare, and then versus a broader base which is nationwide. I do think that in terms of healthcare, the way that the state is going forward, there is a concern about rentals becoming too high, which is why they're looking at a few models which are not just looking at the price going forward. So that is a balance that the government has decided to take. Now, obviously, the policymakers will be trying their best to achieve a good balance. Nobody knows where exactly the balance lies. And obviously the policy cannot be 100% perfect, but I think the general approach is to be lauded.
Well, this high rental price has even called the attention of Health Minister Ong, who has expressed his dismay. In a Facebook post, he said, going forward, bids for future HDB GP clinics will be assessed using a model that focuses less on price and more on quality of care. Now, under the pilot, the tender price or the rental bid will account for 30% of the scoring criteria and will be evaluated by HDB. Now, the quality of the tender proposal will account for the remaining 70%. What would this model of quality care over price look like, though? Will this be the same approach as a pilot at the Bidadari BTO announced earlier in May?
Yeah, I think it may well be. After looking at the prototype, this might be well reproduced, But as I said, I think the devil's in the details. How do we actually compute the 30% and how do we compute the 70% in terms of quality of care? For example, if I'm the top bidder, do I automatically get 30 points? If I'm the second, do I get a little bit less, or do I get a prorated amount according to my bid? And then for the 70% quality, again, how do we weigh what is quality so that GP clinics who are interested to make a bid can assess how to make a competitive bid? And at the same time, we don't want to unjustly prejudice smaller GP outfit, maybe a single doctor versus a large group. Does the system, inherently favor larger groups versus a single doctor? Those kind of things have to be taken into consideration, and I suppose this will be known more when we know about the details.
But is there a way to ensure that the new 70-30 price quality model remains objective and not susceptible to subjective bias when evaluating quality of care?
So I am very sure that the actual assessment will be done objectively. It's whether it's a systemic issue. In other words, when we look at the form of the submission, are some things weighted more heavily? Because that is a system issue, which, there's always room for improvement. In the actual execution of it by the public servants looking at it, I think that would definitely be done in an objective manner. So there are two things to consider here. How exactly you achieve objectivity through form is of course, not an easy question to answer. Again, 70-30 is an arbitrary number. Why not 80-20? Why not 60-40? The line has to be drawn somewhere. So I think they're using this opportunity to see what kind of bids gathers from the GPs, and then the government will take it from there.
Right. Well, before we let you go here, Professor, what else will you be looking out for in this space?
Well, my own prediction, of course, is that the $50,000 or $52,000 bid is an outlier, is a statistical outlier. So we wouldn't know whether, so my own prediction is that it won't be repeated in the future, right? So I'll be looking to see whether future bids around this number or as I predicted, is it really just an outlier?
Right. Well, thank you so much, Professor, for joining me today.
Thank you very much. Glad to be.
Thank you. That was Professor Edward Tee, who is Associate Professor of Law and Urban Fellow at the Singapore Management University and consultant at WongPartnership. This has been The Big Story with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.